Hi, everyone. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area, and we are joined now by Dr. Vanila Singh, clinical professor at Stanford University School of Medicine, as well as a former chief medical officer with the Department of Health and Human Services. Dr. Singh, always good to have you on here as we break down some of the latest developments here in the fight against the coronavirus. And let's start here in California. Across the country, we've seen a lot of states beginning this process of reopening. And here in California, we had the governor today say that by the end of the week, we may start moving into phase 2 of the reopening plan. So there could be more retail businesses that begin to reopen, some manufacturing businesses as well, but there are going to be modifications. What do you think things are going to look like here as some of the stay-at-home restrictions begin to ease?
Well, I think it's going to be a great welcome movement forward for many folks who are really looking forward to getting their livelihoods back. It is going to be in, in the guidance that is currently existing in terms of maintaining social distance, really to address the risk that still is there about getting the virus from respiratory droplets. And of course, I think people are going to keep hand hygiene. I see businesses going to a new level of cleanliness and minimizing the risk of viruses remaining on contact services to really provide reassurance and confidence for folks as they re-enter the workforce at this very unusual but hopefully welcome time.
We're not talking about people sitting down in restaurants at this point, at least here in California. We're not talking about, hotel hospitality industry getting back up and running. That all that stuff is a ways off.
Yeah, actually, exactly. So I think it'll be a nice ease into it because while there are folks who are really wanting to get back to work, there are also folks who remain worried and concerned, especially if they have medical issues that makes them more vulnerable. Maybe they're, at a certain age, or just having the fear and anxiety and trying to recall what normal is. So I think even by definition, no matter how fast we do it, people will slowly emerge. Confidence will hopefully build as we watch the numbers, as we trust that our fellow folks in society are going to adhere to this, which I believe very sincerely that they will, because most folks are aware that it's a privilege right now. It feels like a privilege to get back to doing what we're used to. So I think restaurants and other retail stores and businesses are going to go out of their way to really gain the confidence of the community. They're certainly motivated in terms of disinfection and cleaning procedures and maintaining social distances. We've already seen that in critical industries, in the grocery store, food industries, and definitely in hospitals and clinics. I mean, there's been a great effort to really minimize the risk of transmission, which is not going to be very hard, I think, for the non-critical industries to replicate.
Yeah, well, it's all about, as you said, it's all about putting the public at ease and having people feel confident and comfortable and safe being at these businesses, and that's what this is all going to be about. Let's talk about another big development over the past few days or so, and that's the fact that we have a local company here in the Bay Area. That's Gilead Sciences in Foster City, and they got emergency use authorization from the FDA for their drug remdesivir that's showing really promising results in terms of helping people, COVID patients, kind of shorten the time that they are sick and the seriousness of their condition. How big a breakthrough is this drug?
Well, I'm so happy that the early signs that people were pointing to about remdesivir from Gilead may actually be promising. Remember, it was first a medicine, an antiviral for Ebola, and then there were folks, smart folks out there who were thinking that it may have value in this. So it's really nice to see that the recent studies, different clinical phase trials, have pointed to the drug actually leading to a faster recovery time. And the University of Chicago, their arm of the study was looking at 125 people. They had 113 who were enrolled, and they found that all of those folks had really great improvement in fever and need for supplemental oxygen and just faster recovery times. It was about, when they were comparing it to another arm, about 31% faster recovery, which is really important. There was also an improvement even in mortality. If I recall correctly, it was like 8% versus 11.5%. But there were folks that they interviewed after who felt like it was a miracle drug for them given the severity of their symptoms. And Gilead is still under an emergency use authorization, so it still has to go through all the usual processes of a new drug application, since this is a new disease that they're applying for. So that part of safety and efficacy is still going to be evaluated. They'll have to still go through the randomized clinical control trials. But for now, the preliminary results are really promising in the sense of severe diseases, and maybe even the fact that a 5-day regimen proved to be helpful, with some folks still getting the 10-day, but a 5-day means we suddenly may have more supply than we realize.
Yeah, and it sounds like Gilead is taking all the supply that it has of remdesivir and giving it to the federal government, and they in turn will be sending the drug where it's needed most, anywhere in the country, to help people. Bigger picture here, in terms of trying to find a vaccine for the coronavirus. Obviously, we know researchers here in the U.S. and around the world, everyone working as hard and as fast as they possibly can toward that goal. We hear different timelines. The president, in an interview last night, suggested that a vaccine could be discovered by the end of this year. You hear Dr. Fauci and others say it's more like 1.5 to 2 years. How far off do you think we are, and what are the biggest challenges that are posed to researchers trying to come up with a vaccine?
So that's like the question of
Yeah.
the day, right? Or every day is the question. And I think when you hear the discrepancy, it's really Dr. Fauci and others who are experts in this realm looking back historically to how long it's taken to develop a vaccine. And in some cases, some viruses never even get the vaccine developed. So that's where that comes from. And then they're looking at how long a trial would take to not only establish that virus, whatever the form is that they're testing, that it's efficacious, that it's actually effective in stimulating our body to build an immune response, the first line of defense, but that it's safe, that we can actually do it with the minimal of acceptable risks, which any agent has. So that's the time that it takes. But I believe in this really unprecedented era that we're in with the global pandemic, in this time where we have social media, modern technology, the ability to reach across the globe. The coordination and collaboration is intense. I mean, there's so much data and information that's being shared like never before, because everybody's got a vested interest in getting this contained and getting their economies all going again. Every country, I don't think anyone's really spared. It's just a matter of how much they're affected. But that, with all the science and the data being shared in global trials around the world and different parallel efforts. So there's like different vaccine trials going on for different types of vaccines. So I think when the president is speaking about a potential earlier timeline, he's likely referring to the here and now, and not in the historical sense. But you really need you want sort of the larger kind of view of it, but also the public health experts who really understand where we've been.
You alluded to this, in the beginning of your comments, but what about the notion that we never find a vaccine for the coronavirus? I mean, you look at HIV, for example, and 4 decades later, we don't have a vaccine for it. We have obviously some very effective treatments, but we don't have a vaccine. How likely do you think it is that might be the same situation with COVID-19?
It's possible, whether it's probable given all the efforts. And really, we had a bit of a head start because of SARS and MERS in the past. But yeah, when you think about just other viruses and how they are, HIV went into our immune system, our T helper cells. I remember this, and went right to the heart of it. And the SARS virus acts in a very different way. It's, as you know, everyone's talking about the spike proteins on it, and so they're using those proteins themselves. In some cases they're trying to get the cell itself to make it. It's just really ingenious thinking. But even when we think about historical efforts, and maybe with HIV and its vaccine, in today's world, every day in this realm of molecular biology, bioengineering, and the genetic advances, genetic therapy and whatnot, I could see now really as a perfect storm in many ways as far as the scientific community is concerned, with the added need in terms of the economic impact this has made, that I'm very hopeful that these experts out there putting all of those scientific advances that we have now as an advantage as opposed to the past. And it's also revived the conversation. I mean, there are people who have been dedicated to HIV vaccine, but certainly it's come to the forefront in a lot of discussions too.
Yeah. Yeah, certainly people are, so many people around the world are committed to finding this vaccine and doing what they can. Let's talk sort of big picture about, we often talk about, being in the midst of this first wave of the coronavirus. We're hoping that, in many cases, at least here in the US, that we're seeing the cases begin to peak. But then we hear about this notion of a second wave later this year, another wave potentially next year. There was a report that was compiled by a number of public health experts suggesting that we could have coronavirus continuing to spread for another 18 months to 2 years. What do you think that kind of prediction is based on, and how many more waves are we to expect here?
Yeah. So those experts are infectious disease experts, I believe, from the Center of Infectious Disease Research and Policy, and they've been studying pandemics. They felt that this virus really has to affect 60 to 70% of the population. That's what their model and their report was really built on. So that's a large part of the population that it still would have to make its way through before it disappears. That's the premise of it. They felt it would take, based on that, 18 to 24 months. But it's interesting because they laid out 3 scenarios. One is a scenario where now that we've had the big, huge first wave, we would have a series of smaller waves until it eventually, left us, which would go into 2021.
Right.
The second scenario is the one that I think everybody's worried about, because that's their worst case scenario, where, just like you mentioned, we'd have a second wave that was equal or worse even. And the reason is they felt like when we're lifting these restrictions, people are going to go out, they're going to forget about all these mitigation efforts, and then boom, it's going to just hit again, because it hasn't hit the whole population. And that's kind of the worst case. The third case is the one you heard, where eventually it just burns out down. It's a slow burn. It takes its time.
Yeah.
We're able to manage it, kind of have a bit of a new normal, as people talked about. Eventually it leaves. The second one is the one that they think that we should be predicting and using our efforts, government policy should be focused on that second wave. And I think it's good to be prepared for the worst, hope for the best. However, the only thing I would add to that is that we know more now than we did before this first wave, where it was unexpected and it was brand new virus. We've learned a tremendous amount in the last 3 to 4 weeks about the characteristics of the virus, what affects it negatively. Of course, all our therapeutic efforts and advances, talking about remdesivir.
Yeah, in terms of treatments, I mean, it seems like the medical professionals,
they're all there.
Yeah, have developed. They've just been learning on the fly in a lot of cases in terms of how to treat patients, and they've come up with all sorts of different treatments that now they would have in their toolbox, right? If you have that second wave. Yeah.
As does public awareness, right?
Right.
The second wave wouldn't be the same way the first wave hit us blindly. We already now know, and so I think the public awareness will play a big role too.
Yeah, and with that being said, in terms of the public's mindset here, we have the reopening process beginning to happen here. And, and you talk about people kind of letting their guard down a little bit, getting back into stores and sort of normal life. Should we, though, in the back of our minds, be expecting that if we start to once again see cases begin to peak, that we may have to lock things down once again, like we have done over the past couple of months?
Yeah, I mean, I think the public would actually probably not be totally surprised, because what was really hard to hear and even know how to implement as just average people walking around, and all of a sudden we're told, I think number one, we would probably know how to do it quicker,
Mhm.
and we probably could get there pretty fast. My hope is we'd be nuanced and surgical in our identifying outbreaks and getting to them faster, quicker. Definitely, the hospitals now know what it means to have ventilators and PPE. Not that they didn't know before, but to actually have just gone through it, they're prepared. I think the mindset is there. We know that the supply chain and the stockpiles for not just the federal level but state hospitals themselves, it's all there. So I believe in many ways we're very fresh and mindful of it, and so I can't imagine that we would just suddenly forget. This has been a
Yeah.
tremendous effort, and it had a tremendous effect on all of us.
As we wrap up here, let me ask you about some of the other key. We talk about the hope for a vaccine. The other key factors that you have to look at here when you talk about getting fully reopened, is having testing to a point where it should be, and then also the idea of contact tracing and being able to have the resources to track down people who may be sick and the people that they've come in contact with. Are you seeing enough progress being made in terms of ramping up testing? I think a few days ago we saw the whole, the city of Los Angeles, for example, they became, the largest city in the country to offer free testing to anyone who wants it. Symptoms, no symptoms. We have a lot more testing, it seems like, here in the Bay Area as well. Do you think are we getting to a point where we're going to be able to test, as many people as should be tested?
I mean, we're definitely headed in that right direction. I mean, I just went in last week and got tested myself
Oh, okay.
because it's like easy and available. Before, when this all just started, it was a little clunky and how do you do it? And now we know that it's not just the public health labs, but it's all these private labs and companies that are doing it. And that was both the PCR, the actual traditional test, the kind of uncomfortable one, as
Mm.
well as the serology test. And I've heard from so many people who are doing it. So that, to me, when I look at my own experience and what I'm hearing around, means that it's making its way. And I also heard from a friend who's not in the medical field that she just went and got tested with her whole family. So it's out there. Our pediatrician sent us a note that the kids and families can come and get it done. So it seems like it's making its way in a very substantive way. All the hospitals definitely are doing it. So we're moving in the right direction. What I'm really looking forward to is understanding from that better epidemiological understanding of the rate of infection, the rate of prevalence, and how much conferred immunity we have.
Yeah.
Ultimately, I think that's going to be just really important to know. And the contact tracing, just like you said, it's going to help us definitely snuff this out if we're able to better identify, who someone is who may have it, and then who they've come into contact with. And that will probably have even more value in certain parts of the country where there's density and there's challenges and more vulnerable populations.
Yeah, and once you reopen, being able to do that, testing in a rapid fashion, and then the contact tracing, and tracking down people that have come in contact with a patient who's sick, that can really help you, as you said, stamp out, a small outbreak in a certain community, if you have to. All right, well, we'll leave it there. Appreciate you weighing in here on some of the big news this week on the fight against coronavirus. Dr. Vanila Singh, clinical professor at Stanford School of Medicine and a former chief medical officer with the Department of Health and Human Services. We always appreciate you coming on and appreciate your insight. Enjoy the rest of your week. I will let everyone out there know that we have more information for you up at our website. It's coronavirusnow.com. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area.